Welcome to our latest edition of our Brain Talks, a podcast series organized under the umbrella of the Brain Innovation Days. In today's Brain Talk, we are pleased to welcome back another speaker from our latest Brain Innovation Days digital session on fast-tracking brain innovation in times of COVID-19, Dr. Tomás Ryan, Assistant Professor of Neuroscience at the University Trinity College, Dublin, and Chair of the FENS-Kavli Network of Excellence. Welcome back, Thomas. During the last event, you provided the concluding remarks, sharing the perspective on an early to mid-career fundamental neuroscience researcher. Your intervention touched on how the scientific community is going to respond to the pandemic in terms of European brain health and brain research, and the central issue of harmonization and collaboration in research. COVID-19 brought most fundamental research to a halt last year, which of course was a huge impact at all levels, as everything we were able to do within neurology and psychiatry comes from basic neuroscience. We'd like to expand a little bit more on all of this today, and I will be your moderator, Frédéric Destrebec, the Executive Director of the European Brain Council, one of the founding partners of the Brain Innovation Days. So, Thomas, before we go into the topics that I just mentioned, I just wanted to ask you to maybe have a few words on the FENS-Kavli Network, what it is, and maybe introduce yourself and your personal background into this organization.
Well, thank you for having me, Frederick. My current role is chair of the FENS-Kavli Network, which is a network of early career neuroscientists from across Europe. And there's 30 of us at any one particular point in time. We recruit people once every 2 years, 15 people into a cohort. It's very competitive. We try to represent the diversity of neuroscience expertise in Europe at early career stages. And the function of the FENS-Kavli Network is to improve collaboration between European neuroscientists, but also to try and have an impact, a positive impact on the future of neuroscience in Europe. Myself, I'm a behavioral and systems neuroscientist. I'm at Trinity College, Dublin, in Ireland. I'm originally from Ireland, but I did my PhD in the United Kingdom and my postdoctoral training in the USA before returning to Europe. And the FENS-Kavli Network has been really important for me, not only for developing my own career, but for integrating with European neuroscience. One thing about European neuroscience is that we're not so nucleated in certain cities or certain places. People are very spread out, not only in very different countries, but in universities and cities throughout Europe. So for myself, being in Dublin, which is not the most dense place, not having the most active scientific population with respect to places like London or Berlin, being a part of the FENS-Kavli Network has really been transformative for my young research group's exposure. And we're working on fundamental mechanisms of learning and memory and the relationship of memory to instinct in my own team. But the FENS-Kavli Network cover all of neuroscience, from people who work on Drosophila to people who work on human cognitive neuroscience, people who have fundamental neuroscience questions, and people who have more clinical neuroscience questions. So we cover everything that is happening really in European neuroscience.
Mm-hmm. Thomas, at the event, you were commenting on the impact that COVID-19 has had on the neuroscience research community. You just mentioned that it's a community rather spread out, but working very much in networks and with I would say, a nurtured collaboration. Where do you see that the impact of COVID-19 has been, and can you maybe elaborate a little bit more on the words that you had in April?
The pandemic has been devastating in many respects for scientific research happening in all countries. The exception maybe if you're in Australia, New Zealand, South Korea, probably things were less effective, particularly in South Korea and Taiwan. I'm sure things went quite smoothly, despite the realities of the pandemic and how it has affected travel. I think when you ask the question, what is the impact of COVID-19 on neuroscience and on brain research, it really takes you down two different directions, because one, of course, is how this is going to change how we view science as a society and how we prioritize what's important to us in science, and how we change how we're doing things so we can enable scientists to contribute positively in a rapid way. I mean, we did change the rules around vaccine development in a large respect, which allowed us to respond effectively. And I think we need to learn lessons like that going forward. But also it's how COVID-19 and the pandemic affected neuroscientists, how it affected how we're doing our science, and the cost of this pandemic on scientists, on scientific researchers, and how we can mitigate for that going forward. And they're two very different things, but they are happening in parallel. Now, with respect to the first point, which is what is this doing for how we're going to look at brain health and mental health, which of course is a form of brain health going forward, we don't yet know the long COVID costs that are relevant to the brain. So we don't yet know what COVID-19 is going to be doing to neurological disorders, to neuropsychiatric disorders, to neurodevelopmental disorders, and also to what one might call the normal range of cognitive function in the human population. On top of that, on top of the direct effects of COVID on brain health, are the indirect effects. The indirect effects meaning, of course, mental health damage in the population, which is not caused necessarily by being infected with SARS-CoV-2, but is caused by living in a pandemic, losing your job, not being able to go to school, and not being able to interact socially, not being able to travel, and the stress and the uncertainty, the financial loss, the loss of stability and predictability. All of these things are going to have a significant mental health cost, and both of these things, both the neurological and neuropsychiatric effects, and also the more general mental health effects, are going to be borne out over a number of years. Now, we don't really know what the effect is of COVID-19 on the brain, because we just don't have enough information yet. The reason we don't have enough information yet is for, well, two broad reasons. One is that our human studies have been limited, and the other is that our animal studies have been limited. Now, the reason our human studies have been limited is because the nature of long COVID is that it is long. So we have not yet had the opportunity to really see what the long-term effect is long-term effect of COVID is in the brain. The reason the animal studies, of course, a huge amount of neuroscience is based on animal studies. That means work in non-human primates to an extent, but primarily in rodent organisms like rats and mice, is that, first of all, most people's labs were essentially shut down for months of the beginning of the pandemic, and then took a long time to restart again because of lost resources. And for a long time, even up until now, in many places have been functioning in a socially distanced manner. And this has really restricted the amount of progress that we'd like to make. But more than that, doing COVID-19 research in animals is not a very straightforward thing to do. So some places are doing it, but a lot of places are not. And this is quite unusual for any disease of this importance, that we would not have a large amount of animal research over a year into the pandemic, but we don't. We have a very small amount of research that has been done on this. And it's not just because it's difficult to do it for the health and safety issues, of course, of handling SARS-CoV-2 infections in live animals in a laboratory environment, but the fact that the standard variants of SARS-CoV-2 don't infect rats and mice. So people who wanted to work on COVID-19 in the brain were restricted to transgenic lines that were originally engineered to be susceptible to SARS. And they also are susceptible to SARS-CoV-2. And there are consortia that have been set up specifically to use these lines in specific places, and some of them are in Europe. And they are having an impact, but it's still quite limited. Now, recent variants of SARS-CoV-2, like what we call the variants that were first identified in Brazil and in South Africa, they do seem to infect rodents. That may expand the amount of research that is happening on them. And so far, it's quite limited. What we do know is concerning, because what we do know, mainly from human studies, but also from some animal studies, is that SARS-CoV-2 does infect the brain. So it has a neurotropism. It doesn't just cause neuroinflammation. When we consider the effect of what viruses are doing to brain function, on the one hand, you have the neuroinflammatory effect, which is essentially your immune system reacting in a way that can be damaging to the brain. This is generic to many kinds of infections. So in other words, we can learn certain things about other viruses and what they do to the brain, and have some reasonable degree of concern that the same things are going to be happening in SARS-CoV-2 infections. But also this virus does infect brain cells directly. And one of the early neurobiological effects of SARS-CoV-2 infection is insomnia. So you lose your sense of smell and taste to an extent, and you get a burning sensation, and this can last quite a long time. We were slow to pay attention to the brain effects of COVID-19, even though there was early reports from China on neurological effects. And since then, the situation has become a little bit clearer. We have neurological studies which were pioneered by such people as Michael Zandi in London, where you basically look for people with rather severe neurological conditions, and you ask, were they more likely to have been infected with COVID-19? Or were their conditions exacerbated by having COVID-19? And it became clear that there was an association there, and that SARS-CoV-2 infection is contributing to neurological disorders, and in certain cases to neuropsychiatric disorders. But you're dealing in those kinds of studies, in those kinds of clinical studies, with, in a lot of cases, rather extreme cases. And they do exist, and they're not infrequent, where people will have severe COVID-19 and will have what can be regarded as a relatively severe neurological phenotype or effect. And in some of these cases, people had pre-existing neurological conditions that were made worse, but in some cases they didn't. And so this is concerning. But then we also have what it's doing to the normal population. By the normal population, I mean the general distribution of human beings of all ages that have no particular pre-existing condition, and then they get COVID-19. And then that may affect how they function in the long term in a way that wouldn't necessarily be diagnosed as a disease. So if you looked at a particular person before and after they've got COVID-19, they might report brain fog, they might report fatigue, they might report mild depression, or they might not. But either way, if you did a comprehensive cognitive test on them, you may find slight differences in attention or slight differences in memory. And of course, you could argue, well, that might have happened to them anyway. So you can only know about this through controlled large-scale studies. And these are starting to happen One particularly enterprising one is being conducted by Professor Adrian Owen in Western University in Canada, which is looking at the effect of infection of this virus on memory and attention in the normal population to try and figure out what's happening there. And there's been similar studies in the UK and elsewhere on the effect, on the mental health effect of being infected with COVID-19, again, in the normal population. And there seems to be an effect there too. And the feature of long COVID, and long COVID is a real disease. It has been dismissed in many aspects of the media, but it is a real condition. Of course, it doesn't just affect the brain. Long COVID affects the lungs, it affects joints, it affects many systems in the body because COVID-19 is a multi-organ disease. But the feature of long COVID that's, I think, very, very important to remember is it doesn't really care about your age. So whether you're likely to be in hospital because of COVID-19 or to die from it is very much related to your age and pre-existing conditions. But long COVID affects people of all ages, as far as we can tell, to similar degrees. And it seems to affect 1 in 9 people who've been infected with SARS-CoV-2 in a significant way. 1 in 3 people who've had a pre-existing condition. And we don't know how long these kinds of symptoms last. We don't know how much of an effect this is going to have on the population in years to come. There have been some encouraging reports that vaccination somehow is actually ameliorating some of the effects of long COVID in people who were previously infected, which is hopeful, but that's still something we don't know very much about. And with respect to the broad picture of brain health, clearly we're operating still very much in the dark. We know that it affects the brain directly and indirectly. We know this has effects in neurological disorders, psychiatric disorders, and the normal cognitive performance of people who don't necessarily get those kinds of disorders. But we don't know to what extent, and we don't know how long it will last. And we're obviously completely in the dark on the effect of it, on the effect of SARS-CoV-2 infection on brain development.
But you mentioned, Thomas, you mentioned the lack of retrospect to a certain extent. But at our event, you mentioned the example of Spanish flu. Do you think that the two are comparable? Because you were mentioning the surge of Parkinson's disease cases back in the time. I mean, do you believe that this is something that could be likely? I mean, obviously nobody has a crystal ball, but how can we learn from let's say this past experience that Europe and the world has gone through, and where do you see that basic research can actually provide answers to that?
So I think we have a disconnect between epidemiology, public health, and much of the rest of biology and medicine. I've been involved in organizing a number of very high-profile biology conferences. I mean, conferences that were supposed to encompass all of biology and medicine to a certain extent. And you might have one speaker sometimes on infectious diseases. It's not that infectious diseases are dismissed or are not a well-funded part of life sciences. Of course they are, but we don't pay enough attention to them. I think we kind of see it as one particular aspect of biology. And now it is absolutely central to how we're thinking about science and medicine. I think this is especially true when it comes to neuroscience. Most neuroscientists seem to have no interest or awareness in this, and I didn't either until the pandemic happened, which is what has been the brain effect of previous pandemics. You mentioned the example of Spanish flu, which is a relatively recent example because it happened in the early 20th century, but unfortunately we still don't have rigorous data on the neurological effects to it to the standards that we would expect today. Nevertheless, there have been several scholarly reports that have tried to analyze the apparent surges in Parkinson's disease and also in sleeping sickness that followed the Spanish flu in ways that no one seems to have predicted at the time. And obviously these are in people who survived the original epidemic and then suffered to a large extent other disorders, which may have been attributed to being infected with Spanish flu around 1916 to 1918. So do we have reason to think that a similar thing will happen with COVID-19? No, is the short answer, for the reason that it's a very different virus. But we do know that SARS and other coronaviruses have had effects on the brain. And we probably know more, in fact, however, about SARS-CoV-2, about COVID-19's effect on the brain than those, and it is having an effect on the brain. So the main thing that we have are a few known knowns that this disease, COVID-19, does affect the brain, and a lot of known unknowns, and that we don't know how long these effects are going to last and how much they're going to affect the population, and unknown unknowns. So unknown unknowns meaning things that haven't really popped up yet at all, but might show up later down the line, because either they haven't manifested yet, or we just haven't had the opportunity to observe their manifestation, if they're necessarily long-term things that may affect people in later life or in early life. So we have to keep an open and cautious mind there. I don't think that this disease is going to cause sleeping sickness or Parkinson's disease in a few years' time. I'd be amazed if that happened. But the Spanish flu is a it's a warning example of what can happen. And I think that the research that will be done over the next few years on animal models by fundamental neuroscientists will be a large part of for want of a better term, the early warning systems for what can happen. So you can learn something about a 20-year effect on a human by doing a 1-year experiment on a rodent. And so these kinds of approaches, I think, will give us some insight into the future. But I think brain health is something that we don't normally think of on a population effect, and a large part of a lot of health, it seems to be that way to me, in that we have a society that values medicine rather health. We value treating a disease when it's happened, rather than creating an environment that encourages health and prevents diseases from happening. This also creates a public misunderstanding of how things work. Sometimes as scientists and as medics, when we're communicating risks to the public, particularly in the context of COVID-19, you can get criticized for scaremongering people, because someone will say to you've just mentioned 20 or 30 diseases that are caused by SARS-CoV-2 in people who don't die from SARS-CoV-2, who survive COVID-19. And they don't believe you because they don't see that happening. And because it's not happening, because we're not actually trying to communicate a one-to-one causal relationship. It's not that because you get infected with SARS-CoV-2 that, a few weeks later, if you survive, that all of your organs are compromised as a diagnosable medical condition for the rest of your life. That's not what's happening at all. What we're talking about is increasing the risk factor for many of these disorders, such that a subset of people who get infected will have some of these conditions. And the feature that's so relevant in the context of a pandemic, particularly one like this one, is the capacity for this virus to spread through the population like a wildfire, the capacity for it to really get very quickly through large swathes of people. And as a result of that, you're rolling the dice with every person, and you're going to have a very large subset of the surviving population that has significant damage that is manifest neurologically or in a neuropsychiatric manner. And I'm particularly concerned about this in the coming months. The reason I'm particularly concerned about this in the coming months, in the developed world and in the coming year to year and a half in the global south, is some places may decide to open up when the vulnerable are vaccinated or when most people are vaccinated, but not everyone is vaccinated. Because they will argue that because of vaccinating the old and vulnerable, the death rate is much, much lower than it would otherwise be. Might be 80 to 90% lower, but still significant. The hospitalization rate is also much lower, but the long COVID rate will not be, because the long COVID risk affects people of all ages. So you can imagine a situation where people in their 20s, 30s, 40s, and early 50s go into a herd immunity by infection situation instead of a herd immunity by vaccination situation. And in that scenario, which I hope doesn't happen anywhere, but which the media and some political influences do seem to push for in many European countries, you will necessarily get a very large long COVID burden that will be manifest in terms of brain health for years to come. I don't think we can afford that. I don't think we should let that happen. And that is the main concern. But and that's what happened if Spanish flu did contribute to those neurological disorders. That's the kind of thing that happens, is that it's not a one-to-one causal relationship. It is about significantly increasing risk to the population, which still makes the risk to an individual relatively low, but the risk to the overall population very high. And it's not about uncertainty. We hear a lot when dealing with COVID-19 about risk and uncertainty, and we don't know if this is going to be a problem. We do know it's going to be a problem. We just don't know who it's going to be a problem for, but we know it's going to be a problem for a large section of our population. And that's something that we need to prevent, but it's also something that we need to prepare for, because this has already happened for large subsets of the population. It's going to continue to happen. We have to worry about new variants that will be vaccine evasive, particularly as much of the world is not vaccinated. We've been very lucky so far, because the COVID-19 vaccines have been super effective. And even with new variants emerging that have some degree of vaccine escape, those new variants still don't cause death or severe disease, it seems, in people who've been vaccinated for different variants. And that's very encouraging. But the variants so far that avoid previously learned immunity can still transmit between people and affect unvaccinated people, and that's the problem. So the burden of this on brain health, we don't know what it is, but we also are in some degree we're in a position to mitigate against it, and that's why the coming year or so is going to be very important.
And Thomas, in that respect, I wanted to ask you a question specifically on the extent to which neuroscience research was supported by or prioritized by the European Union. One of the things that you had said at our event was that, and I quote you, European funding has not been keeping up with the world in terms of neuroscience research, end quote. So here, I mean, would you see that there is an opportunity now that health research has been really put at the, I'd say, into the political spotlight to a great extent? And would there be an opportunity to reprioritize health research, but also brain research, particularly along the lines of the impact that you just singled out?
Yeah, I think that the world woke up to the value of scientific research after World War II and because of World War II. And particularly the United States immediately recognized the benefits of investing in fundamental research. And this has impacted the private sector in innumerable ways. I mean, computers, the internet, microprocessors, and much of modern medicine really came from publicly funded research in the United States and also in many other countries. And I think we need to take that to the next level. And I think the pandemic will be the motivating factor for doing that. And I think we need to also be very clear with people that this does not happen based on demand. It doesn't happen based on marketplace demand. We need to have the public sector, we need to have universities, well-funded universities, create the incubator for scientists to do science, because the science itself cannot be produced by short-term market-driven incentives. It just doesn't work that way, and it never worked that way. And I have to say that in Europe, we don't always recognize this. And the reason that we don't always recognize this is precisely because we are a union of very different countries, and many European countries are small countries. Now, I can say this because I'm Irish, I'm from Ireland, I live in Ireland. And we're a tiny country, and being a tiny country means we sometimes do things a bit differently, and we have than you would do if you were a big country. And one example of that is science funding. In Ireland, I think we focus too much on applied science funding. I think we focused to our peril on science funding that is based on national priorities that align with industry that maybe they're at a given time. And the justification that people who should know better will give for that type of strategy is that, well, we're a small country and we can never compete with the United States anyway. So we should really occupy a space on the translational applied side of research. And we'll get some of the benefits from that corner of the research market. So that strategy has been taken not just in Ireland, but in many other European countries. And of course, this filters into how Europe overall thinks about European research, particularly through the European Commission's support of research through Horizon 2020 and FP9. The exception, of course, is the ERC, the European Research Council, which is pure blue skies research. Now, not only is this a mentality that can't compete with a place like the USA, but it's also wrong. And the reason that it's wrong is that no amount of public sector engagement in translational or applied research can compete with pharma, can compete with what the pharmaceutical company is very much incentivized to the pharmaceutical industry is very incentivized to engage with. What smaller countries should be doing is attracting individuals to work on fundamental research, which always leads to unanticipated benefits, both in terms of the outcomes of the research itself, but also into helping the community around them and to developing the community around them. In the case of Europe more broadly, we need to have a mentality of doing exactly that. We need to have a mentality that is two-pronged, in my view. One is to invest financially in research to the same degree, or hopefully a greater degree, than the United States of America is. And this should be done through, in my opinion, through centralized programs like the ERC. We need more organizations like the ERC. You could argue that maybe the ERC is not the best fit for everyone, and that would be true. And then it's about whether we diversify the ERC or whether we have other things like the European Innovation Council, which is dealing with a particular aspect of the research ecosystem. I think that the current model for Horizon 2020 funding in general needs to evolve, however. The mechanism itself isn't very important. What matters is two things. One is that the investment is there, but the other is that you attract, you retain, and you enable the human talent to do it. That means the researchers to do it. And provided you have research scientists who are motivated and enabled and allowed the time and freedom to engage in fundamental research, it will happen, and it will happen successfully. And at the moment, this seems to me to be the major challenge for European science, and as a result of that, for European neuroscience, which is, how do we attract people to come to Europe, not just because they want to return to Europe because perhaps the European, or because they're married to a European, but because they see that being in Europe is a new opportunity for them that's maybe somewhat different than being in the United States or being in Asia. And to make it straightforward for them to come here, and to come here quickly, and to come here with the resources to develop and lead an internationally competitive research group, and then to retain them. And the retaining issue is one that I know is causing a lot of people increasing anxiety in Europe at the moment, people in research careers. And this was the case before the pandemic, which was that the ERC, European Research Council, has been phenomenally successful in what it's doing. It's not funded enough, in my view. I think that the funding should have been significantly increased. And I don't think the neuroscience components are adequately funded either. But within its capacity, it has been immensely successful as a funding organization. I would regard it as one of the most successful funding organizations in the world. But there's a cliff. There's a cliff that happens after people get what would be their ERC Consolidator grant. There are not enough ERC advanced grants for everybody who is capable of delivering one. That's just an obvious fact. Which means that the ERC is not a sustainable mechanism for being the central support of a neuroscientist's career for the next, for most of their middle and late career, unless something changes. Which means that neuroscientists are dependent on other mechanisms. And it's just a little bit shakier than what you would be looking at in the United States, where the main funding mechanisms are pretty consistent relative to the population right up to retirement. And I don't pretend that the American situation is all flowers and rainbows. I mean, science is fiercely competitive in any country, and there are problems everywhere, and there's too much talent and not enough resources, and it's really an unfortunate issue. Science is organized by accident. It evolved as a kind of a pyramid structure. We evolved into rather a kind of a pyramid structure where there isn't enough long-term sustainable careers for scientists, but also within those who do stay in science, there isn't enough funding support. And perhaps the pandemic will change that. But nevertheless, the US is in a much more sustainable situation than in Europe, because if you work in a good American university, you know that if you stay productive, the resources will always be there. And if you're in Europe, it's not always the case. It depends where you are in Europe. It depends what place you're in. And we need to move away from that. We need to move towards a situation where European neuroscience at a continental level is consistently supported. And I think if we don't do that, then we're going to see in the coming 10 years and beyond, we're going to see a brain drain, and we're going to see a situation where European neuroscience is still quite functional, but is not quite what it was, and certainly not what it could be going forward into the future. Because what we have is not just about the talent base, it's also about giving people freedom. And I know more than one young American researcher, some people who are in the FENS-Kavli network, who are from America. Perhaps they surely could have stayed there, but for whatever reason, they ended up launching their own research careers in a European country. And you're talking about particular individuals. They've done quite well, and they have remarked to me more than once that there's an element of freedom that has been afforded to them by being in Europe, in the sense that once they had the space and the resources to engage with their topic, they really felt much more empowered and liberated to be very creative and very daring with their research here, to be much more entrepreneurial, that in a way that they may not have been in the United States, for the reason that they may have found themselves being a little bit more conservative in the choices that they would have made in their early research careers. So that's something that we have that I don't think we make enough use of. We don't encourage researchers to be, we do, but we're not aware that we do encourage researchers, or we have an environment that allows researchers to be quite daring, provided that they can get sufficient resources to work with. So those are the opportunities that I see right now for European neuroscience and the challenges. But I'm struck by, when we talk about the effects of COVID-19, as was discussed at the Brain Innovation Days events, that what you saw was a lot of patients, patient advocate organizations, and neurology and psychiatry organizations focused on the human cost, focused on the clinical cost of brain health and of not investing in brain health. And of course, that's extremely important. And that is why, to a large extent, we do scientific research. And that's what politicians understand. That's what policymakers understand, is the effect on human beings. But there's a disconnect there, right? There's a disconnect between why we're in a situation where we can't treat these conditions and how we can do something about that. And the only way that we can do something about this is by investing heavily in fundamental scientific research. And population health is going to be a huge part of this, particularly when you're talking about psychiatric, the variation in mental health in the human population. But with a large portion of brain health, that's not going to be tractable when you're considering things like Alzheimer's, like dementia, like Parkinson's disease, like multiple sclerosis, like a lot of developmental conditions that affect the brain. Unfortunately, much of that cannot be mitigated by lifestyle changes, and not to dismiss the importance of preventative health that I was discussing earlier. We know that in the developed world, we know that people who live until into their 70s and 80s and 90s, that over 1/3 of us will suffer some form of dementia. And this is becoming an increasingly huge burden, socially, economically, and personally, on the human population. And we're just not getting close enough to doing anything about this. And I can guarantee you that none of this will ever be solved by the kind of research and development that is happening in pharmaceutical companies around the world, because they're not even close to scratching the surface on it. We're completely in the dark about what we can do about most neurodegenerative disorders. For psychiatric disorders, we're still using rather primitive pharmaceuticals because we've got nothing better, things that were being used in the 60s and 70s. And for neurodevelopmental disorders, we're also quite hamstrung by our lack of knowledge, our lack of basic knowledge of these disorders and how to prevent them and then how to mitigate for their effects. None of that is going to be solved by anything but fundamental research. And at the same time, neuroscience is currently undergoing a renaissance internationally because we have the methods and tools to deal with these things that we didn't have before. When I was a graduate student, I started in 2005 as a graduate student, and we were in a different era. We were in an era of basic physiology, of using genetics to manipulate the brain in a rather crude way. And then things started to change. And now we have a complete array of different brain imaging technologies and brain manipulation technologies for really manipulating and really reading out what's happening in a functioning brain. We're currently lacking good ideas. We don't know very much about how the brain works. We're rather trapped in I think, very old ideas about brain function that just aren't keeping up with current data. And we're figuring things out. But we have a huge generation of very talented young neuroscientists that are coming along. And they are the main asset, just as young people are the main asset for all of research. And what happens is they go and work in other things. Person does their undergraduate degree in science, but then they look at the scientific career structure. It's very, very competitive, very limiting in some ways, and so they decide to do something else, or they do a PhD, and then they do something else. And that doesn't happen in a lot of other areas of society that should be considered as important. And I think that we need to recognize this. We need to recognize how much science we could be doing that we're not doing, and we need to find a way of funding it. And it's the solution to these problems is so straightforward. The solution is about ring-fence money for this purpose, and then attract young individuals to work on these problems, and then just enable them to do so. It's something that's not happening to a sufficient extent in any country, but is something that Europe in general, I think, is very well positioned to begin to do with the recent pandemic and its effect on brain health being a motivating factor.
Well, thank you very much, Thomas, for all this insight and for providing us also a perspective and recommendations as to how strengthening the, let's say, resources that we have. And you mentioned young scientists as being, let's say, the reservoir or the hope for the future in order to address all the key challenges that we have addressed and that we have discussed today. It's time for us to bring this podcast to a close. Thank you again for joining us today and sharing your perspective. I'd like to thank also all listeners for tuning in, and we hope that you enjoyed today's Brain Talks episode. Please make sure to stay tuned and to follow us on social media for all the latest episodes and latest news. Until next time, thank you.